Do you have pain slightly below the kneecap when playing basketball, running, jumping? Have you tried rest and ice and the symptoms just don't go away? You might have jumper's knee. So if you do, stay tuned in this video because we're going to go over all of jumper's knee 101, meaning the mechanism of injury, the signs and symptoms, the recovery, and also how you can prevent it. So stay tuned, guys. Hey, what's up, Hoopers? My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength Conditioning Specialist and co-founder of the Basketball Doctors, alongside with Dr. Gabriel Ignacio. If this is your first time seeing our videos, hit the subscribe button to be subscribed to our videos, and also hit the notification bell so you can be notified when our new videos pop up. All right, Hoopers, so we're going to talk about jumper's knee. So if you're watching this video, you probably have jumper's knee or been told that you have jumper's knee. So before we go into exactly what jumper's knee is, we're going to go over the anatomy of the knee joint. Okay, so this is your right knee. So if you're looking at this right knee, this is the quad tendon, which is from the quadricep muscles, turns into this tendon and attaches to this kneecap or the patella. From the patella, it goes to the patellar tendon and attaches here in the tibial tuberosity. And on the outside here, we have the lateral collateral ligament. Here we have medial collateral ligament. Underneath the knee, deep inside the knee here, we have the ACL ligament and the PCL ligament. Alongside with the meniscus, we have a lateral, meaning the outside, and medial part of the meniscus. And this big bone here is a femur. Bone here below it is a tibia, and this is the fibula. So that's kind of like a quick anatomy of what the knee joint is. But we're gonna zoom in now to the problem area, which is the patellar tendon. So as we mentioned before, the quadriceps are the muscles, the big ones in the front of your leg. They attach into the quad tendon, which goes to the patella or kneecap. And from the kneecap, it turns into the patellar tendon and attaches here to the tibial tuberosity. Now that we know about the anatomy of the knee joint, specifically the patellar tendon, we're gonna go over what exactly is jumper's knee. So jumper's knee, contrary to what a lot of people believe, is not tendonitis. So tendonitis is inflammation of the tendon. Jumper's knee is actual degenerative changes to the patellar tendon, meaning as a result of this trauma over time. So jumper's knee, you won't get it after a week. You'll get it usually at 4 weeks of this non-stop repetitive trauma on the patellar tendon, meaning jumping, running. All right, guys, now that we know that the patellar tendon, there's some degenerative changes in the tendon, we're gonna go over how that occurs. So degenerative changes in the patella are a result of multiple things, but one of the biggest things we see is this increase in training volume or intensity, and also this return to sport after this onset of rest or not doing much. So we're gonna go over a little bit more about those. So the first scenario, increased training volume and intensity. So let's say you just started a jumping program, and this jumping program requires you to work out 6 days a week, and you're jumping more than usual, and you're still playing basketball. So you're increasing your training volume and intensity, meaning you're doing way more than you were doing before. And then after like 4 weeks, studies have shown, you start seeing some degenerative changes, meaning you're gonna start seeing some pain. And once you start seeing some pain, you'll be like, oh, I haven't really, I didn't fall my knee, I didn't do anything, but it's the result of this increased training volume and intensity that your patellar tendon has not been able to keep up with. So it gets to the point where it's breaking even, so that's when you start having that pain. So it's a result of that increased training volume and intensity. So you have to really make sure the program that you do is slowly ramping you up. Another one, let's say, especially during this pandemic era, you haven't been playing basketball, or someone that took a month or 2 off, and then you just jump back into your regular routine as opposed to ramping it up. So you jump back into your regular routine of playing basketball 5 days a week, training 4 days a week, or whatever your routine is, but you took this delayed time of not doing anything for, let's say, more than 30 days. And once you jump back into it, you're gonna start having some issues at about 4 weeks because your patellar tendon hasn't been ready for this increased loading demand. So the biggest thing is there's no true mechanism of injury, meaning traumatic injury, meaning you're not gonna get hit in the knee and that's gonna cause jumper's knee, or you're not gonna land on it. It's gonna be more of just this increased loading. This increased loading from one, like we mentioned, from just an increased program thing that you're doing. So you're increased in the amount of jumps or whatever, running or cutting movements, or you're coming back from an injury or time off and you just go back, jump back into it. So you need to slowly ramp up and get this patellar tendon working. So that's the main mechanism of injury. So it's not this just acute trauma, it's a over time chronic condition that leads to this jumper's knee. Then we're gonna go over the signs and symptoms. As we mentioned, the pain's gonna be in the patellar tendon, usually below the kneecap, so slightly below the inferior pole here. And it's also sometimes in the patellar tendon. And in rare cases, but it is common, it's right above the kneecap, but that's more quad tendinopathy. But we're gonna focus more on jumper's knee, which is usually more patellar tendinopathy. So it's that sharp burning pain, usually with running, jumping, or even sometimes going downstairs, just more loading the patellar tendon. And there's different phases. So one of the phases is that people get pain once they start playing the sport. So meaning they're okay, but once they start jumping, running, they'll start having pain in the patellar tendon. The other phase is people have pain when they're warming up, but once they are ready to warm up and everything, they have no pain while playing basketball. And then the other phase that I've seen people too is they could play just fine, but after they finish playing, they start having that pain. So that pain in the patellar tendon, they're able to jump, do everything, but once they stop playing, they just go into regular activity, just walking, they'll start having that patellar tendon pain. So those are some of the signs and symptoms that are consistent with jumper's knee. We're gonna go over the risk factors and how you prevent jumper's knee, because jumper's knee is a highly preventable injury. So number one, the biggest thing as we mentioned before, is load management. So making sure whenever you go into a new training program or you get back into playing basketball, you have this ramping up progression, meaning you don't wanna go from 0 to 100. You wanna go slowly into your activity. So it's a step-by-step progression as opposed to just a quick ramp up. The second one is we're gonna start from the ground up, ankle mobility. If you don't have good ankle mobility, it's specifically dorsiflexion range of motion, meaning if this is my foot here on the ground, I wanna be able to lift my toes up off the ground pretty easily. So another test that we do is if you put your foot down on the ground and there's a wall, you should be able to drive your knee and hit the wall without letting your heel come off. That's a good measurement of dorsiflexion range of motion, because if you don't have that good dorsiflexion range of motion in the ankle, whenever you land, you're not gonna be able to accept the force as much as you can because you don't have that good dorsiflexion range of motion, and it's gonna mess up factors going up the chain. Now the third one, at the knee joint, we have to have good quad strength, because if you don't have good quad strength, whenever you land, jump, you're not gonna be able to accept the forces in the quad. It's just gonna go straight into the patellar tendon. And we have to get the patellar tendon a little stronger too. And that's by getting the quad stronger. The third one is the hip strength. So if you don't have good hip strength, specifically external rotation and abduction, meaning those glutes, everyone talks about, hey, use your glutes. If the glutes aren't working, whenever you land, you're not gonna be able to accept the forces. You're not gonna use those big, powerful glute muscles, and you're only gonna use the quad muscles, which is gonna put more stress on the patellar tendon. Now then we work on the actual flexibility portion of the knee joint as well. So meaning like the rectus femoris and the hamstring. Those muscles, the quad muscles and hamstring muscles, not only have to be stronger, but flexible, because that is gonna play a huge role in our last thing, which is the mechanics. So whenever you land, jump, run, or cut, you have to have good mechanics, meaning you don't wanna land too much or jump too much using just your knees or your quads. You wanna have a little mix between quads and hamstrings and glutes, because you wanna be able to have that force be distributed between all those muscles, especially those glute muscles that are very strong and big, and a lot of people don't use those, and that leads to too much of this knee strategy. So whenever you jump, land, you're gonna have your knee bending too much forward and putting a lot of stress on the patellar tendon and not using your glutes to kind of help with that, especially when you're landing too. To kind of recap, we have the first one is the one that you have to kind of take in control, is the load management, so slowly ramping up. The second one, we have the ankle dorsiflexion range of motion, meaning you have the good flexibility at the ankle joint. The third one, we have the quad strength and also the hamstring strength here at the knee joint. And the fourth one, we have the hip strength. Glutes have to be strong to be able to accept the force and use those muscles to help distribute the force around when you're jumping and landing. And the fifth one is gonna be the landing mechanics. So you gotta make sure you land correctly and jump correctly. That way you don't put unnecessary stress in the tendons. All right guys, we're gonna go over a quick summary regarding what jumper's knee is. And we're gonna talk about what we mentioned before in the video. So as we mentioned, jumper's knee is a degenerative condition in the patellar tendon. So it's not an inflammatory. So rest and ice don't work. We have to load the tendon. And the reason this is caused is because of this abnormal loading, meaning you're jumping into an activity too fast, too soon, and also the risk factors that we mentioned before. So if you, after watching this video, think you have jumper's knee, we have an 8-week jumper's knee program, which consists of a 5-day week per week program. Click the link below in our description and you'll have this access to our 8-week program. All right guys, thank you guys for watching this video. If you liked it and if you found it helpful, please like, comment, share, and subscribe to our channel, and share this with other friends and family members. And we really want to reach out as many hoopers as we can to really help them out. And if you didn't like it, please comment below and let us know what we did wrong so we could fix that in our upcoming episodes. So we are the Basketball Doctors. Let's ball for life, guys.